So pulsed radiofrequency to the suprascapular nerve is a technique that we use for patients who have shoulder pain. The suprascapular nerve supplies approximately 85% roughly of the nerve supply to the shoulder joint. Now, if patients have shoulder joint pain, it's vitally important that they have had all the appropriate investigations, x-rays, MRI scans, that sort of thing. They've often been treated with simple painkillers, analgesics, anti-inflammatories and that sort of thing. And very often by the time a pain clinician such as I am sees them, they've already seen shoulder surgeons, shoulder specialists and that sort of thing. So this is a technique really we use where a lot of other treatment options have essentially failed and we're left with a patient who has persistent pain. They've probably also had arthroscopies, keyhole surgery, surgery itself to the shoulder. They may have had lots of injections of steroid and other substances into the shoulder joint, and again, all of those have failed. The procedure itself is very simple, very safe. It can be done as a walk-in, walk-out procedure. It can be done under local anaesthesia or under sedation. And essentially, the patient will come in. The suprascapular nerve can be located at the back on the scapula. There are what we call anatomical landmarks that we use in order to locate where it is. And we clean up the area. It's thoroughly disinfected with antiseptic. We put some local anaesthetic in the skin. We put a very small, very thin radiofrequency probe down to the suprascapular nerve. And then from the radiofrequency machine, we use sensory and motor modalities to locate the suprascapular nerve. When we're doing that, we're talking to the patient, we're getting feedback from the patient to make sure we're absolutely in the right place. Once we've located the nerve as accurately as possible, we then put cycles of an electrical current, pulsed radiofrequency current, through the suprascapular nerve, and that will actually treat the nerve. It does that by reducing the oversensitivity of the nerves, stabilizing the membranes, making the nerves actually function more effectively. It also increases nerve growth factors and other useful effects. As with all procedures, there are benefits and risks. The benefits are pain relief, takes about 10 to 14 days to work, sometimes less, sometimes more. Risks, failure, local bleeding, bruising, infection, discomfort, they're all minimal. The one complication we always worry about with this procedure is something called pneumothorax, which is puncturing the lung. We do the procedure as safely as possible. Often we do it, we do it with ultrasound guidance or X-ray guidance, and using the anatomical landmarks and using guidance, the incidence of pneumothorax is incredibly low. Even if that were to occur, the needles that we use are very small, and any serious problems from that are minimal. Overall, the procedure for pulsed radiofrequency for the suprascapular nerve is a very safe procedure. When it's effective, it can allow incredibly good pain relief for a patient, and it will allow them to go on to continue with their physiotherapy-based rehabilitation. It will break the cycle of their pain and allow them to rehabilitate overall.